Here's more dogma that needs to go the way of the dodo bird. Not giving meds for abdominal pain because it's going to mask important assessment findings. This isn't just antiquated thinking, this is extinct thinking. This is my grandfather. He was a doctor. He was born in 1908. He graduated med school in 1935, which was back when they were still teaching tasting pee to determine whether a patient may be a diabetic. Back when German doctors were measuring people's heads to see if they had a propensity for criminal behavior, and most importantly, before we had things like CAT scans. This whole withholding pain meds thing was antiquated back then. This idea, this mantra, this dogma that has still somehow stuck around to today was published 14 years before my grandfather graduated medical school. 1921, Cope's early diagnosis of the acute abdomen said to not give any pain meds until a surgeon can evaluate the patient because pain meds will mask important assessment findings. And we know that today this isn't correct. Numerous studies have shown that giving analgesia does not affect diagnostic accuracy. And let's not bullshit anyone, the patient's going to be getting a CT scan. Now, I know that some provider in the comments is going to tell me that's not correct, but I did unscientifically poll a couple of real world ER physicians and ER nurses to estimate how many patients with abdominal pain get a CT scan, and here's what they said. I am not one of these people who is all about giving meds just because I can, and I am not sure that I subscribe to the whole pain being the fifth vital sign. If I have a patient who is in agony or is really uncomfortable and I have the means to safely make them feel better, then it's cruel not to help them out. You're seriously just going to sit there and stare at them? They even wrote about this back in 1871. I'm not saying that you need to put the belly pain patient into a K-hole or that you need to be pushing a heavy pour of fentanyl into a 90-year-old with a tummy ache, but treat the patient's symptoms. Many EMS services have a slew of options available now, not just opiates. I'm all about using the non-opiate stuff. We use the IV Tylenol where I am. But the thinking that you can't treat these patients because it's going to mask important symptoms is like O.J. Simpson, bad and dead. So when an FTO or a medical director or a senior medic says, don't give pain meds to that patient, tell them to grab their cane and hobble out of the time machine and then show them this reel.